In this video, I want to introduce you to some of the concepts of general bacterial diagnosis and treatment. When we're talking about diagnosing infection in the lab, especially for those of you who are going to be one, on the patient side, or two, on the laboratory side, this information is really important for both the medical professional and for the laboratory professional. What are some of the more important factors you need to think about when you're going to collect a sample? So that would be the medical professional. When you're handling the sample, which would be both the medical and the laboratory professional, and processing the sample as the laboratory professional. So in your reflection, I want you to think about what some of the most important features are. And then after we go through these slides, think about, is there anything else that you learned that you would add to your list of important factors? One of the first things we have to think about is, what sample are you actually going to collect? Do you need blood? Do you need a skin swab? Do you need saliva? Do you need a respiratory sample? So what exactly is it that you need? These tables are found in the new textbook, but they're a little bit bigger, so they're hard to put in these slides. So these are just screenshots of the tables from the older edition of the textbook. But again, the 8th and 9th edition of the textbook have the same information in these tables. Well, do you need to collect blood? That's hopefully not a very common thing. You often should not find blood that has an infection in it. You shouldn't be finding bacteria in the blood, but sometimes you might. So what you have to think about first is that you need to disinfect the skin, because you don't want to introduce skin bacteria into the bloodstream. That could cause a big problem. But you also don't want to contaminate the blood sample with skin bacteria that might make it look like a patient has an infection when either they don't, or the infection they have is a totally different organism than the one that is actually growing in the blood. I'm not going to ask you details about, what volumes you need, because that will be really dependent on your lab and how you process things. For intracellular bacteria, considerations are the same. Depending on the specific organism, the type of culture that you end up plating may be a little bit different. And then, they give a very specific example. If you suspect a leptospira infection, blood is only useful during the first week of illness. So the other thing you want to think about as the medical professional, you don't want to inundate your lab with samples that aren't going to be useful. So you don't want to sample the entire body of the patient when you suspect one type of infection versus another. So you have to be really cognizant of the trajectory of the disease and which samples you need to collect. If a patient is experiencing neurologic complications like meningitis, you may want to culture the cerebrospinal fluid. Again, you need to collect it aseptically. You want to disinfect the skin before you go in to do that spinal tap. Other areas of the body that should be considered sterile: the abdominal area, the chest area, around the heart, again, aseptic. And then if you have to collect urine via a catheter, or if you have a catheter somewhere else in the body, again, disinfect the site and collect the sample as sterilely as possible. And those are pretty straightforward. It gets a little more complicated when you start sampling in areas that have their own microbiome. So for example, if you are trying to sample the upper respiratory tract, if you suspect a patient has some sort of upper respiratory infection, you have to be really careful. Like it says here, if you're collecting a swab of the throat, let's say you suspect your patient has strep throat caused by streptococcus. You want to avoid contact with the saliva. So why is that? Well, because the saliva contains lysozyme, which is an enzyme that would destroy peptidoglycan. So if you got saliva on the swab, it's entirely possible that that saliva could destroy the bacterium, giving a negative result, even though your patient does have an infection. The epiglottis is this little flap of tissue that protects us from inhaling food, basically. So it covers our trachea when we're swallowing so that food will go down the esophagus rather than down the trachea. You have to be really careful though if you're going to swab the epiglottis. There are a couple of infections that can cause epiglottitis or infection in the epiglottis, but when it's already infected, it starts to swell, and if you swab it, that can irritate it enough that it can swell even more and completely close the respiratory tract, causing your patient to die. So when you're talking about children, you almost never want to swab the epiglottis. Instead, you may want to do a blood culture if you suspect a patient has the epiglottis infection. The sinuses, again, it's, almost irrelevant unless you get all the way into the sinus cavity. If you happen to get the nasal cavity or the oral cavity, there's so many bacteria in there, it's not going to be informative. But the other issue is that a lot of the bacteria that cause sinus infections are just the normal bacteria of the nasal cavity or the oral cavity. A lot of times, if you've ever had a sinus infection, it's usually preceded by cold-like symptoms, and that can cause swelling and a backing up of the sinuses, doesn't allow it to drain properly, so those bacteria can grow in there. So those are all things you have to think about. I've never had my sinuses cultured for a sinus infection. They generally just throw some antibiotics at you, and it's good to go. If they suspect strep throat, though, they usually will swab it. For the lower respiratory tract, so the lungs, the bronchioles, etc., that's going to be pretty challenging. So you can collect sputum. So if the patient is coughing up some mucus, if possible, you want them to rinse their mouth first, then they can cough deeply and try to get as much as possible. You can also do a bronchoscope or a direct lung aspirate, which is as unpleasant as it sounds. So a needle going directly into the lung to gather the bacteria. The ear, if a patient you suspect has an ear infection, if it's an external swab, it doesn't really mean anything because the bacteria in the middle ear or the inner ear can be totally different. So you want to use a needle and a syringe to actually sample if you're trying to diagnose which infection it is. For surfaces on the eye, again, eyeballs gross me out so much, so I don't think I'd ever be able to do this or have this done to me. But you can do a swab of the surface of the eye or a corneal scraping if you suspect more of a surface level infection. If it's a deep infection, you will have to, it's really gross, aspirate the aqueous or vitreous fluid. So that's unpleasant. And then if a patient has anything that's draining or ulcerating, you can take that fluid that's come out and try to culture it. But as much as possible, you want to be careful to avoid contamination with the surface itself. Usually these are not going to be anaerobic bacteria because if they are draining on the surface, it's a surface level type wound, it's most likely going to be an aerobic bacterium. If a patient has a deeper wound, like an abscess, you can try to culture aerobically. It could be potentially an anaerobic infection. Again, sample with a sterile needle and syringe. If your patient has kind of a big tissue infection, you could always take a sample of that lesion from the center and then from the edge to try to recover organisms. You can also collect urine specimens. Most commonly, if a patient has a suspected urinary tract infection, they simply urinate and use a cup, a sterile cup, to catch the urine midstream. So you want the patient to have started to urinate because that flushing could get rid of any like skin bacteria that might be there. And then midstream should be any bacteria that are present in the urinary tract or in the bladder that are causing the symptoms. You have to transport these very, very quickly and start to culture them very quickly because they will be contaminated with normal skin bacteria, which can quickly overtake an infection. So you want to make sure that these get taken to the lab right away. If a patient has a catheter in already, you can use the catheter to sample the urine. It is not recommended to use a catheter to diagnose a routine infection. When you insert a catheter, there's a huge risk of causing infection. So you don't want to take that risk if you don't have to. So generally for just a standard urinary tract or even bladder infection, you'll likely just have them, a patient who walks into the clinic, just urinate in a cup. If the patient is already hospitalized and has a catheter, then you can sample from the catheter. Really, really ugly way to do it is a suprapubic aspirate. So just like it sounds, you use a needle to directly sample the bladder. That, as it says in the box, is very invasive. But if you suspect an anaerobic infection, that's the only way to get the anaerobic organism. It is also useful if your patient just can't give you a clean sample. So they say, like for children, because children may not wipe themselves enough to make the skin clean to catch the urine midstream, or if for whatever reason you have an adult who's also not able to do that, you could do an aspirate that way. For the genitals, there's a couple different kinds of ways that those can be sampled. Again, it depends on what you're testing for. If you're testing for any one of the sexually transmitted infections, generally you just use a specially designed swab. You can, in males, use a urine sample as well, since the urinary tract and the genital tract are the same. For females, you cannot. Females do not have a conjoined urinary and genital tract. There are two separate openings. So you would want to sample both. So the endocervix, so inside, and the urethra, you would want to culture if you suspect any sort of genital infection in a female patient. Sometimes the symptoms can be kind of similar, pain, burning, and that's not necessarily just because of a sexually transmitted infection. There are also just standard vaginal infections that are not sexually transmitted. Fecal samples is about as easy as you might expect. You collect the feces in a sterile cup and transport them to the lab because some of the compounds within the feces can degrade the bacteria. So you want to get them over there pretty quickly. So the detection and the identification of the organism, again, depend on the organism. You may do microscopy or antigen detection or nucleic acid detection. When we're talking about just standard bacteria that grow on a plate, we often will just turn to culture. That's one of the easiest and least expensive ways to detect and identify an organism. But we can always go to some sort of serological or some sort of nucleic acid test if we're having trouble using culture to identify, if we're talking about an intracellular bacterium that's very difficult to culture, if we need a more rapid response. So there are lots of options for those of you working in a clinical setting for how you want to detect and identify the infection.